Hello, ladies and gentlemen, audience, former patients, prospective patients, all that are out there. This is the third of our Facebook live series for 2016, possibly the last one for this year. We may start again early next year. It's been a lot of fun doing these Facebook live sessions. I've done one, and this is my second one, and my esteemed associate, Dr. Amira Sankey, was with me for the last one. I hope that you're enjoying it, and please send in any of your questions. We're here once again in Sydney on a beautiful Sunday afternoon. I can look out of my office window here and see the harbour with a few sailing boats on it. It's a bit hot and humid, a bit warm and sticky, but a lovely afternoon. Some patients have written in advance, and maybe they like to be anonymous and not have their Facebook details up on the screen. One question I have, we launched a website, a new website, approximately 2 weeks ago. And I just wonder if anyone's had a look at that website, and if you've got any comments, if you have anything you'd like to say about the new website. I know that our practice manager has put in an enormous amount of time trying to make this one of the most professional, excellent websites you've ever seen. It's full, chock-a-block full of information, lots of diagrams, lots of photos, before and after photos, lots of interesting information relating to plastic surgery, as well as injectables, fillers, the Medi-Spa that we have, which does skin treatments, lasers, old therapy, cool sculpting, all sorts of things that we can do to help you in your aesthetic quests. A question I've had in advance from Joanna is, what is a full facelift? And in fact, that's a question that I actually often ask, because we have lots of patients who come in and they say to me, I don't want a full facelift. And I say to them, well, what is a full facelift? Because we as surgeons don't know what is meant by a full facelift. We never use the term. It means nothing to us. I think that what a lot of people think a full facelift is doing like the brow lift and the upper lids, the lower lids, the face, the neck, and just like the entire face. However, the way that we approach things, we think this is brow lifting, right? Or lifting the temple, because most people need the temporal part of the brow lifted rather than the full brow. This is upper lid surgery, this is lower lid surgery. And a facelift essentially means from the face going down onto the jawline, into the neck, and lifting up down to the lower neck. And so that's a lower facelift, or what we call a facelift. A lot of people say, well, what's a mini lift then? Well, that is a term that we sometimes use. And in relation to a mini lift basically is incisions around the ear, etc., very similar to the incisions of a so-called lower facelift. And the incisions, though, don't go generally behind the ear and don't really give you a great deal of improvement to the neck. So you do get some decent improvement to cheek area, lower face, jawline, and minor improvement to the neck. Right? That's a mini lift. Whereas with a lower facelift, it's assumed that that is part of the neck is part of a lower facelift. The reason that we don't say facelift and neck lift when discussing this or putting it on the surgical forms is hospitals are always on the lookout for, can they make some more money, and can they charge you more? So if we say, look, we've got Mrs. Smith here, and we're going to do a facelift and a neck lift, then all of a sudden the hospital is like, hello, 2 operations. Well, let's charge for 2 operations rather than 1 operation. So we always put it down basically as just a lower facelift. If you have any questions about that, please follow them through. It's always interesting to know what other people feel. A lot of people do think that they can get really decent improvements to the jawline and neck by doing a mini facelift, and it's very appealing to have that word mini because it makes it seem like it's a lesser operation, that less is being done, and in fact less is being done, but the upshot of it is that you get less improvement to jawline and neck. So that's really the difference: mini facelift, full facelift, lower facelift. And as I said, we actually don't use the term full facelift. We really don't know what that means. A question that a patient called Margaret has asked is, what's the deal with your waiting list? We often get patients' emails and letters very frustrated that they can't get in to see me. I have had waiting lists as long as 2 years in the past. We try very hard to make sure that people can see me as soon as humanly practical. The waiting list currently is not that long. However, it is a good idea if you can possibly give us an idea if you are seeking a specific surgical date or a specific surgical time that you have in mind, because that gives our reception staff a bit of an idea. Can we try to get you onto a cancellation list? Can we try and bump you up a little bit? Can we move things along? I often see patients, unfortunately these days, on the rebound. So they come in and they say, look, I tried to get in to see you. I was unable to see you, so I went to X, Y, or Z. And then they're coming in with things that need fixing, basically. It's no other way to put it. Unfortunately, a lot of people are not particularly educated between the difference between plastic surgeons, cosmetic surgeons, and we do have people who go overseas. Look, it's like a lottery. It is possible to get some good operations overseas. It's possible. The likelihood is low. We have patients who the latest hotspot is Korea, South Korea, because South Korea there's a lot of cosmetic surgery done, and there are some very good South Korean cosmetic surgeons. However, the patients that I've seen coming back from South Korea are distraught because they go there and they have lots of faith that they're going to get good results, and lots of slick marketing goes on. There's very little English translation, there's very little English communication, and we see them back here in Australia with all sorts of problems, problems with rhinoplasties in particular, but we're also getting lots of complications and problems in rhinoplasties from local ear, nose and throat surgeons. Ear, nose and throat surgeons call themselves plastic surgeons, facial plastic surgeons, but they have not completed a course in facial plastic surgery. And the biggest amount of revision rhinoplasty surgery we get is from ear, nose and throat surgeons, unfortunately. However, we do have a cancellation list, and we do try and get you in as soon as humanly possible. And as I say, especially if you have a surgical date in mind, please let our staff know, and we try to accommodate that. Maria Barra writes in, what's the difference between dermabrasion and microdermabrasion? And interestingly, on our new website, we have photos of dermabrasion, and what we call dermabrasion is surgical dermabrasion. And it's very, very different to microdermabrasion. In microdermabrasion, crystals basically are fired against the skin, and it's like airbrushing. So the crystals basically brush off the outside layers of skin, and this is a highly effective treatment for skin, not necessarily wrinkles, but for skin tone and texture, particularly if it's associated with a medifacial, with driving in vitamin A and vitamin C deep into the skin. And the vitamin A gets into the cells to cause the cell to produce more collagen, elastin, hyaluronic acid. Vitamin C, obviously, a great antioxidant. So microdermabrasion is excellent for skin tone and texture. However, it is an extremely superficial treatment, which is fine because it's a walk-in, walk-out treatment, and we do it here all the time. I thoroughly recommend it and think it's an excellent treatment. However, surgical dermabrasion is a very, very different kettle of fish. Surgical dermabrasion, excuse me, surgical dermabrasion is peculiarly suited for upper lip. and works incredibly well for what are called smoker's lines. Just out of interest, smoker's lines have got absolutely nothing to do with smoking. Smoker's lines, which occur as vertical lines in the upper lip, almost exclusively occur in women. Very few men get smoker's lines, or if they do, they get one or two, whereas almost all women with time get the vertical so-called smoker's lines, or the vertical lines of the upper lip. And the reason is that basically thin skin wrinkles and thick skin sags, and men basically have thick skin in the upper lip due to the beard, as I have right now. And the bearded skin is thicker than women's thin skin, and women's thin skin is going straight onto the underlying lip muscle, and that lip muscle, when it moves and when you talk and chew and whistle and kiss people and make all sorts of facial movements, wrinkles, and sooner or later the repeated wrinkling, the repeated contraction of the muscles and dimpling of the skin there causes long-term wrinkles. Now this is absolutely perfect for dermabrasion or surgical dermabrasion. And what surgical dermabrasion is, as opposed to superficial microdermabrasion, is basically a rotating sander. And it's essentially a metal rotating sander with edges that essentially basically want to shave down this area. And it leaves the skin red and raw, and is basically an extremely effective way of getting rid of those wrinkles. One question that we do have from Juliana Shidiak is, what is the difference between a normal plastic surgeon and a microsurgeon? The answer really is that a microsurgeon does microsurgery, and microsurgery relates to surgery of small vessels and nerves, and that's done in things like replantation. So for instance, in trauma and accidents, when areas get chopped off, and I used to do that a lot when I was much younger and working in the public hospital system. So for instance, it was extremely common to have people with digits, i.e. fingers, cut off, thumb cut off. I had a young man once who had his entire arm chopped off. And we do microsurgery to reattach the vessels, reattach the nerves, and then also obviously the bones are reattached and everything else is reattached, but that's not micro, that's macro, because you can see it pretty easily. But the microsurgery is done to reattach all the little vessels and nerves to make this area function again. It's extraordinary the number of educated people who put their fingers in areas that they really shouldn't. People who are, say, lawyers or architects or whatever, and they'll put their fingers underneath a lawnmower, a running lawnmower, to try to clear out a blockage or some leaves or something like that. It really is quite difficult to know why people would do that, but I guess it's just a chain reaction. I'm not exactly sure, but when I was working in the public hospital system, I was told that there was a situation where someone was working in an owner of a sausage factory, and he had some new employees, and he said to them, well, look, whatever you do, don't put your hand into this machine. And he put his hand in and chopped most of his fingers off, and they were replanted. I know probably a little bit ghoulish to discuss on a cosmetic surgery Facebook Live session, but this is the sort of thing that plastic surgeons often train at and train doing in their younger days, as well as doing a full range of cosmetic surgery. I personally now specialise totally in cosmetic surgery. The most interesting thing that I've ever replanted was a scalp, and basically it was a young girl who was in a swimming pool, and this is extremely dangerous and can be extremely dangerous. Actually, it wasn't a swimming pool, it was a spa, and for whatever reason her hair got mixed up and suctioned into the filter or the intake. and essentially it ripped her scalp off, which is obviously fairly nasty. But her parents were smart, obviously distressed, but they managed to keep the scalp on ice, wrapped up in a cool tea towel, and then basically essentially brought it to the hospital, and we replanted it, and 100% survival. And obviously, if you're a young woman, you have your scalp ripped off, and you have microsurgery to put it back on, it's a pretty good outcome. It worked extremely well. Juliana asks, the reason I ask about microsurgeon versus plastic surgeon is in particular relating to the outcome of scarring. Does having one surgeon versus the other affect the outcome of scarring, in particular with arm lifts or thigh lifts? The answer, Juliana, is no. In terms of scarring relates more to how incisions are placed and how they're closed. So, in other words, the way we look at things is there is a thing called Langer's lines. And what that means basically is, for instance, when I smile, I get lines coming away from my eye like this, like crow's feet. I don't have lines coming away from my eyes going this way. The lines are going this way. So therefore, when we do incisions, like when we're trying to cut things out, say for instance, if you're doing an incision in this area, you would do your incision in the natural, normal crease. It's always going to heal better. Now, whether you do that, as a plastic surgeon or any other surgeon, plastic surgeons have various techniques to work out how to put these in lines better, what lengths to use, what ratios to use, etc., how to put the tension deep to the skin rather than in the skin. So there's many different things that we do that optimize the outcome of the wound so that the wound is as good as humanly possible. And of course, when we do facelifts, there's various incisions around the ears, etc., and those incisions are placed in creases so that they're as well hidden as humanly possible. So I think the answer is, Juliana, that it doesn't really matter microsurgeon versus plastic surgeon. Most plastic surgeons train in microsurgery. Very few other surgeons train in microsurgery, but plastic surgeons train in microsurgery, so they know the microsurgical techniques. Microsurgical techniques basically are for putting together small vessels. They're not really related to skin surgery. Skin surgery relates to knowledge of where incisions should be placed, what orientation they should be in, and having them under the correct tension. So in other words, not having them too tight. Pauline Lapetite asks, can I have eyelid surgery in your office, or do you need to go to hospital? Pauline, the answer to that question is we frequently do upper eyelid surgery in the office. It's often done in the office under local anaesthetic with a little bit of oral sedation. So in other words, some Valium or something of that nature. There are various other medications that we use that are a little bit more complex, but basically same effect. So the patients are very, very relaxed, and upper lid surgery very frequently done in the office under local anaesthetic. If lower lid surgery is done though, it is a very much more complex operation than upper eyelid surgery. With upper eyelid surgery, essentially the issues are excess skin, right? And so the excess skin is removed, and usually a little bit of central fat, because that's the fat that bulges with time, whereas the lateral fat tends not to bulge with time. Lower lid surgery though, there's many different issues involved. The issues basically are the length of the lower lid, excess skin, laxity of the lid, potential rounding of the lid with surgery, which you obviously want to avoid, and obviously the fat bags. And so there's many different issues involved with lower lid surgery, and it's a much more complex surgery. And to get the best results, it really is definitely the best idea to go to a hospital and have the surgery under a local anaesthetic, surgery under a general anaesthetic. Now, the anaesthetics we use these days are a little bit strange because essentially with the surgery, the anaesthetist puts you to sleep, then I put local anaesthetic all the areas where we're going to be operating, And with that local anesthetic, it lasts many, many hours these days, like, 18 hours even, 20 hours on many occasions. And that allows the anaesthetist to give you essentially just oxygen through a mask and various things through the veins. Now, you're completely asleep, but it's just not possible to have any lighter anesthetic. So it's a really light anesthetic, and this is for rhinoplasties, facelifts, neck lifts, brow lift surgery, hairline lowering, eyelid surgery. It's because the surgery that we do is relatively superficial. Sure, we're tightening the muscles under the skin and various other bits and pieces, but we're not inside, say, body cavities, and we're not inside joints and things like that. So it's a more superficial style of surgery, and then that allows one to have a very, very light sort of anesthetic. So I think the answer, Pauline, is upper lid surgery, frequently done in the office. Upper and lower lid surgery, usually done in the hospital, because the lower lid surgery needs to be done in the hospital. Lower lid surgery only, usually done in the hospital, because it's a more complex surgery that needs a more complex solution. Someone was asking, what's the best thing to refresh the skin on your face? Basically to treat fine lines, diminish light, sunspots, encourage collagen production. Usually the best treatment, I'm sorry, I think it's rosy. It's a difficult question to answer that question, because the best treatment depends on exactly what's going on with your skin. So I think the answer is essentially come and see us, and in particular either see me, or if you need to be seen a little bit more quickly, see our dermal clinician, who is a wonderful dermal clinician, Chris Antonio. Chris can do a full assessment of your skin and work out exactly what's going on with your skin. And the treatments range essentially from skin creams, right? So some of them can be highly effective if you don't need too much, but are good for ongoing care. The other thing that's quite useful, or can be useful, is old therapy or ultrasound therapy to tighten the skin. There are various light-based therapies like IPL and BBL, which are good for sunspots, red spots, veins, etc. And fractionated laser treatments, which are excellent for freshening up the skin and getting rid of fine lines. So there are many different things that can be done. And look, you really do need to see our dermal clinician and be assessed. There was a question about cost for lower eyelid surgery if you go to a hospital. To tell you the truth, I'm actually not the best one to ask about costs. What happens is that I see patients, and I give my very best recommendation for the best possible outcome. Now, we are mindful of how much these sorts of things cost, and we don't try to subject anyone to extra costs than what is needed. But I give an estimate from what will give the very best outcome, and then patients go and see my patient coordinator or clinical cosmetic consultant, Michelle Kostrikan. And Michelle goes through the hospital costs, theatre costs, surgical fees, etc., etc. In relation to the question, lower eyelid surgery, Michelle, don't kill me tomorrow, but I'm guessing around about the 8,000 mark with hospital, surgeon, anaesthetist, theatre, all visits through to about a year post-surgery. Everything is generally around about that mark for lower eyelid surgery. That's my guess. Juliana asks, do you recommend a thread lift? Do you recommend a facelift for mid-30s? Or what is too young for a facelift if there is such a thing? Juliana, I've done around about 30 thread lifts. I did them when they came out. And what thread lifts are, basically, for those who don't know, is little permanent sutures placed under the skin. And the sutures have barbs on them, little back cuts on the stitch. And the back cut is meant to grab on to the underlying tissue and secure it and hang on to it. And so, for instance, the idea is, say if you put a suture or a thread in this direction and it's got lots of little back cuts, the thread will lift this area up and keep it stuck up like this. I, like a lot of people, initially thought, wow, could be interesting, sounds like a good idea, let's try it. I did about 20 thread lifts on various people. I saw the patients again at 3 months, took photos. I couldn't see a scrap of difference, not a single shred of difference between the before and after photos. So I think the consensus has come down, not just me, but generally anyone who basically is an objective observer. The consensus has come down that thread lifts generally last somewhere between 8 to 11 weeks, which is not a lot of time. And interestingly, it takes around about 2 weeks recovery, and they last about 8 to 11 weeks. So you have around about 9 weeks of benefit out of most thread lifts. Now, interestingly, with facelifting surgery, as an example for this area here, recovery is around about 2.5 weeks, and it's essentially permanent in a fashion. So for instance, if you get 10 or so years of turning back the clock, you will always be 10 years ahead of where you would have been. Like all the rest of your life, the entire rest of your life, you will be a minimum of 10 years ahead of where you would have been. So it is sort of interesting that thread lifts sound like a good idea, take about 2 weeks until you're really good to be out there seeing people, last maximum about 11 weeks, in other words, less than 3 months. Facelifting, okay, about 2.5 weeks. So yes, the recovery time is around about half a week extra and lasts for years and years and years. So from our point of view, we don't really understand any great drive to doing, thread lifts. It doesn't make a lot of sense to us. In relation to age and facelifting surgery, Juliana, the youngest patient I've done a facelift on was 27. We don't go scouring the streets saying to 27-year-olds, hey, why don't you do a facelift? And let's say a normal looking 27-year-old, if they came in to see me, I'd say, look, see you later. Sure, we'd love to offer you, say, for instance, Botox or other treatments as necessary. There's things you can do to your skin. We have an entire sort of armamentarium of things that you can do to help prevent facial aging. Now, this particular 27-year-old had a particular skin disease, and it's the skin disease that causes people to age extremely quickly. And so it's actually quite sad when you're 27 and you look like you're, say, 50. It's a very, very difficult situation. So in the normal set of circumstances, if you think about facial aging starts usually fairly reliably when you're 16 years old. And I know that's a little bit depressing, but looking on the bright side, most of the effects really start becoming obvious in late 40s, early 50s. By the age of 40, though, you have at least 20 years of facial aging on board. And I used to be a little skeptical, well, is it a good idea to do facelifts on 40-year-olds? Why not wait till people are 50 and they're really showing the signs of aging? I'm sorry, but I'm a convert. If you do surgery on people a little bit before they really need it, and that's anyone generally from about the age of 40 to 45, it's a really good time for doing facelifts. It works amazingly, and the reason is you're working with better material. You are definitely working with material which is of better quality. So in other words, the tissues, the skin, the blood vessels, the layers underneath the skin are of much, much better quality. There's less distortion necessary, and so the effect looks more natural and more normal straight away. There's less of a, oh my God, what have you done, sort of worry, to patients that they're thinking they're going to look more different. And it lasts basically 20 years or so, minimum. And so it's actually, I'm a convert to facelifting and doing like a proper live facelift. from the age of 40 onwards. I used to be, as I said, like, at 50 onwards, why not wait until there's some real change? And of course, most of the people we do are having real change, because that's what motivates them to come and do surgery. But if you are the sort of person who basically feels like, you know what, at some stage of my life, I'll probably get a facelift, go earlier rather than go later. It's definitely a good recommendation. In relation to the other age, the oldest patients I've done facelifting on, two people 84 years old. And once again, we don't go scouring the streets of Bondi Junction, saying to 84-year-olds, hey, come in and see us, you want surgery, we're here to do it. Basically, both of these people had parents who lived till over 100 years old. And by their reasoning, they were 84. They're thinking, well, probably got 16 plus years left. Why not? One of them had had a previous facelift and had really enjoyed it and thought they looked great. And they did look great for their age. But it is sort of interesting, isn't it, that within all of us, and particularly with females, I think in this modern culture, and all cultures, I suppose, there is this drive to look as good as you can. And I don't think it's really vain. I don't think it relates to just, vanity and, just elevating appearance over all other features. What I think it relates to is remaining relevant and remaining vital. And fight it as you may, it is true that many older people in our community get sidelined. And it seems as if their opinions don't matter so much, and as if, sure, you've had your time, now sort of like, leave it all to us, younger people, let's say, is a feeling that they may have. And facelifting surgery is reliable rejuvenation, even in people in their 80s. And basically, if you get going with facelifting early, you will look relevant all of your life. One of my favorite facelifting doctors, Dr. Aston in New York, showed us a series of photos at one stage of a patient that he had done, and he'd done a facelift in this patient's 40s, one in the late 50s of the patient, one in the early 70s, and this patient was about 80 something years old and looked essentially 65 or thereabouts, but not weird, looked normal. And looked normal because, firstly, an excellent skilled surgeon who basically trained me, and secondly, the surgery had been done at the right times and had started early, so that there wasn't distortion of features. So look, I think the thing is, facelifting surgery works extremely well any age. Starting young, I used to say no. Why? Now I'm an absolute convert. It's by far the best way to do it. Start young if you can. Don't worry if you're older and you haven't done it, you haven't missed the boat. It can be done extremely successfully and well, but you do get extra boost younger. Juliana asks again, what's your favourite surgery to do, or your specialty in surgery? Juliana, I've been raving on about facelifts now for the last 20, 30 minutes or whatever. I think you can tell that facelifting surgery is definitely my specialty. I was fortunate enough to be trained in this specialty at Manhattan Ear and Throat Hospital in New York. And just as an interesting aside, that was part of the way that we got our name, Silkwood Medical, because a lot of celebrities, and I've met many celebrities actually, a lot of celebrities would come into the hospital and their name on the hospital forms was Mary Driftwood or Mary Silkwood. And that was just, their code name. And interestingly, with these celebs, you would see them without their makeup on, without, sort of either wigs and clothes, and heaven knows what a lot of these people used to wear. And you would look at them, like I would look at them, and have no idea who they were. And then one of their private nurses would say, well, you know who this is, don't you? And I'd be, no, who is it? And they'd say, well, it's X or Y. And I go, oh my gosh, really? And then you go, yeah, okay, I can actually see that. Yeah, look, yeah, you know, that's, you're right, that's them. Anyway, in relation to how Silkwood got its name, um, when I got back to Australia, I was thinking, well, you know what, I'd like to have a clinic, obviously. What do we name the clinic? I was not going to name it Driftwood Clinic. I don't think that would have been too sensible. So we settled on Silkwood. So we named it Silkwood Medical. Um, and so that's been our name since then. So definitely facelifting surgery is my favourite surgery. Olympia Vranos asks, how about leg vein injections? And Olympia, the name for that is sclerotherapy. That's SCLERO therapy. Sclero means the injection of a sclerosant, and a sclerosant is something that irritates the veins. So the vein has an injection placed into it. The injection so inflames the wall of the vein or the vessel that it's placed into, and it can be placed into either a vein or into little arterioles or little capillaries. It so inflames it that it causes the vessel to completely shut down. And when the vessel is shut down, the walls stick to each other and don't allow any blood flow. And so there's nothing flowing along the vessels, so the vessels don't appear dilated. It's highly successful, Olympia. Of course, with varicose veins, true varicose veins, you can't do injections for them. You must go and see a varicose vein surgeon who will probably strip the varicose veins. But small little vessels, whether they're arteries or veins in the legs, in the face, elsewhere, often called spider veins, are very, very suitable for being injected. A question that Julie asked was, are there any new procedures? And interestingly, there is one new procedure, but it's an old procedure that has been worked out how to be done better. And interestingly, this is how a lot of procedures come about. They start off as a particular procedure, and then they're done for a period of time, and then people abandon them because of the problems, and then someone comes along and works out how to fix these procedures and make them better. So for instance, the procedure that is my favorite lower eyelid surgery at the moment is pinch blepharoplasty, where the skin of the lower lid is pinched up and snipped off. And you would think that that's not such a smart idea, because we don't go underneath the lash line like we used to go, because if you go underneath the lash line, you can take out very little skin before the whole lid goes like this. Whereas if you go on the lid itself and remove skin with a pinch from there, you can remove a lot of skin, and it's the best form of skin improvement of the lower lid. There is just anything like it. It far exceeds laser, it far exceeds chemical peel, it exceeds any other modality by 100 times in terms of tightening the lower lid skin, and the incision is basically invisible. I don't like using the word invisible because it's not a great word to use in the context of plastic surgery, but it is to all intents and purposes invisible. So what that surgery came from is, in the 50s, what people did was make an incision right on the lid, go through the muscle to get at the fat bags, take the fat bags out as necessary, pinch out the excess skin and sew it up. And the problem with that was that basically the muscle, okay, so you got your skin on the outside, then you got your muscle in further, and then deep to that you have the fat bags, and then the conjunctiva. So in the 50s, people went through the skin, through the muscle to get at the fat bags, and it's the muscle layer which is the potential bad actor in lower lid surgery. You know those people that you see that basically have the eyelid surgery and they look a little bit like this? It's sometimes due to excess skin being removed, but more often than not due to the muscle being disrupted by the particular technique of lower eyelid surgery. And the problem with that 1950s one was it went through the muscle contracted causing lowering of the rim. Now, what has been worked out over the last 10 years and has been really popularized even over the last 2 to 3 years is to pull the lid forward, come in from behind to get at the fat bags. So that's called the transconjunctival approach. And the muscle is in front of that, so it's not touched. And then come in from in front and pinch out some excess skin. And the muscle is behind that, so the muscle is not touched. And you can take out a huge amount of skin without causing any retraction of the lid. And it's a really, really excellent method of lower lid surgery. In answer to the question, though, about any new procedures, lip lifting has been perfected by a group from Texas. And this is a really exciting development because with lip lifting, many older people get quite a long upper lip. And if you'll bear with me for a minute, it's always worth and interesting to understand the genesis behind all of these sorts of issues. The genesis behind the size of the upper lip basically is the hole where the nose is, called the nasal aperture, increases in size as time goes by. So the skeleton actually changes and fades away. And this is the same for the hole where the eye is. So that increases by 20 or so % between the ages of 16 to around about 60. So the holes in the skeleton basically increase in size, and that means basically there's less purchase or less room for the muscles. So those muscles that come from here that elevate the upper lip, basically the whole of the eye here, or the orbit, is getting bigger, and also the bone is moving backwards. The hole where the nose is getting bigger, and so those muscles basically are not being able to lift so much anymore because they haven't got the grab, they haven't got the land mass on the bone to allow the grab and to allow the pull. And so many people get a much longer lip. Now, of course, lots of people are born with a relatively long lip, and this is exacerbated with age and time. That lip becomes even longer. Now, previously, what the surgery involved was a butterfly-like incision, right, just following the creases of the nose, and as much skin was removed as possible to elevate the lip. But the problem was there was like this push and pull effect. The lip was elevated, but the nose was lowered, right? And there were bad scars. And it was not a particularly successful operation. So usually you would say do it only in people, say in their, I don't know, late 60s, 70s, something like that. People who had enough lines and wrinkles here anyway, who basically were after an effect just to lift the lip, get it out of the way. Whereas nowadays, a group from Texas has perfected this technique, and it was actually really obvious, I guess, like so many smart things, obvious in retrospect. And their idea was basically do these incisions around here, but do one going up into the nostrils. And so what you do is you anchor the lip lift up in the hard tissue of the floor of the nose. And this tissue is nice and firm and is not going to pull out. And it's not going to allow any tension on the wounds of the columella and the alar here, which is the creases around the side of the nose. So those areas don't get pulled down because it's got a nice stable spot inside on the floor of the nose to hang on to. And lip lifting has been revolutionized by this technique, and I'm now really happy doing lip lifting on people in their 30s, 40s, 50s, and I'm hoping to get some photos that I can show you all pretty soon. It transforms facelifting. If you get someone who is, say, in their 40s or 50s and they do a facelift, and I'm sure you can see on our website that a lot of the facelifts look fantastic. Now, younger people generally have slightly shorter lips than older people, and it is a sign of aging. As I've described, there's a mechanism behind it, the increase in size of the holes in the skull, allow the muscles not so much room to pull, and so the lip gets longer. And so if you can get someone in their 40s or 50s having a facelift, and you also, even subtly, slightly shorten the upper lip, it does two things. It makes the lip look that little bit shorter, which looks younger, and it also everts the upper lip slightly. And it has the same effect in some respects as a slight injection of fat or filler in the upper lip. And basically, we often combine this with a little bit of fat transfer to the upper lip. This area has been revolutionized relatively recently by these surgeons in Texas. And we're getting some really, really interesting results, and interesting in a good way, like in a happy way, happy, positive way from lip lifting. Jacqueline asks, is cool sculpting for the face, for the body only, or is it also for the face? Jacqueline, I think the answer is basically you would never do cool sculpting, and just those who don't know, what cool sculpting is fat freezing. And this is one of those areas that seems almost magical. I mean, if you'd thought 10 years ago that you could actually freeze fat and make it go away, I think people would have laughed at you. Now, I actually was in a lecture hall in Las Vegas, I think in around about 2000, 2001, maybe 2002. And Sidney Coleman, who was also trained at Manhattan Eye and Throat Hospital, where I was trained, he's the father of modern fat injection surgery or fat transfer surgery. He gave us a lecture, and he said that he was sitting at his desk over the last, previous few weeks with this thing strapped around his tummy, and he was working on his computer and sometimes even eating chocolate cake and losing weight, right? Losing fat. And everyone in the audience, all plastic surgeons, probably about 100 of us, laughed and said, this is ridiculous. He's actually finally gone completely mad. A great guy and really, really excellent surgeon, Sidney Coleman, so certainly not mad by any means. But he was trialing cool sculpting. And cool sculpting, Harvard University spent approximately $2 billion to perfect the technology behind fat freezing. And it truly works. And the basic gist is that normal cells freeze at 0 degrees Celsius, and this is obvious because basically they're full of water. Fat cells, however, are full of a globule or a blob of fat, and it's like a sort of like a liquid fat, free fatty acids. And when you put weight on, fat goes into the cell. When you lose weight, fat goes out of the cell. And those cells, that fat globule, crystallizes at somewhere between 7 to 10 degrees Celsius. So you've got your normal cell, which gets knocked off at 0, your fat cell that gets knocked off at 7 to 10. So if you can cool this area down to below this temperature but above this temperature, so in other words, say, as they do with cool sculpting, to 4 degrees Celsius, you knock off this cell, the fat cell, right? So that fades away because it's been killed. And then when you basically stop doing the treatment, this one has never got down to 0, so it keeps living. So the normal cells keep living, whereas the fat cells get knocked off. And in each area, about 20 to 25% of the fat cells get knocked off. Now, Jacqueline, the question you asked is, can you use cool sculpting on the face? And the answer basically is you wouldn't want to use it on the face. However, you might want to use it on the neck. If you think of the morphology, and if you look at kids are full. Their faces are full. They're full, and the analogy I use for fullness, and it relates to eyelids, it relates to the facial cheeks, it relates to the temples. In a lot of people, facial aging is a process of progressive skeletonization. So in other words, the skeleton shows through more and more and more. Now that's not for everyone. There are certain people, such as Andrew, who's the next question, who basically are born with either chubby cheeks or obese people, or people who have a bit of weight on. And often you look better facially with a bit of weight on because you are a little bit fuller. So kids, young people, teenagers, young adults are quite full. And the analogy I use is it's like a sail with wind in the sail, and there's fullness. As we age, the wind goes out of the sail, and the sail basically changes in composition as well. So in other words, the skin changes in composition. So we have this sag and this sort of like, lack of fullness. It's like taking air out of a balloon, or taking something out of a paper bag that's been in a paper bag for a long time, and the paper bag all wrinkling and deflating and not having much in there. So essentially, you don't really want to do that to the face, right? So cool sculpting to the face, no. However, it has been shown that many adults will put on extra weight in the neck and jawline, right? Particularly the neck, not so much the jawline, that's really more skin sag. It's really the neck. And that fat is not usually present in youngsters. And so it can be worthwhile doing cool sculpting in this area. And in fact, cool sculpting has a particular handpiece that works in this area here. And the cool sculpting mini basically will get rid of a lot of the fat in this area. And interestingly enough, the thing that's been observed with fat freezing, cool sculpting, is that the skin actually tightens. So liposuction in this area, great. We do it all the time. And if you're young, the skin will tighten to some degree. But anyone who has any sort of age, basically, the skin won't shrink down quite so much, and cool sculpting is a really good alternative because it does help the skin shrink as well. So the answer is cool sculpting can be done man boobs, bra folds, upper abdomen, lower abdomen, thighs, you name it. Cool sculpting can be done, and also in the neck, but not on the face. Andrew asks about buccal fat pad removal. And if I can just simulate for you for 1 second what buccal fat pad removal will do. And I'm just doing this. I'm just drawing my cheeks in. That's what buccal fat pad removal will do, Andrew. It has a bad rap because initially it was described as a technique to make young models look thinner, and therefore, in those days and the way that they thought at that stage, more attractive. And basically, a lot of young models had buccal fat removed when they absolutely didn't need it. They were already skinny enough, and it just, was just the wrong thing to do. Now, there are people who are born with extremely chubby cheeks. It's just their structure. It's just how they're born. It's just the same as whether you're born tall or short, or blonde or brunette. You have no control over that sort of thing. Most of us age by deflation, and that's why fillers and fat transfers are such a good, alternative to aging. So treat the skin with facelifting, and at the same time do a bit of fat transfer, so the facelift doesn't need to be too extreme. And also it gets rid of the signs of deflation, and that's why a lot of injectors obviously get a lot of business by injecting and filling up. However, some people have the structure where they do have extremely chubby cheeks, and for them, buccal fat pad removal is an excellent operation. It's sensational. It's subtle, right? Because basically what it does is this, but it gives some structure to the cheek. So instead of just having this big round mass that really just doesn't have any structure, it just gives this subtle, soft indent in this area, and aesthetically leads to great improvement. Now, a couple of people that I've done, we've done buccal fat pad removal from this area here, we've done lipo of the neck, and even done some cheek implants to get some better sort of definition, and it truly does lead to much better definition and a much better look. So I think you need to find the right sort of surgeon who knows the right amount to remove, because if you Google it, buccal fat pad removal, a lot of people say, oh my God, it's terrible, and it's because in those people it probably should never have been done. So you need to work out or find a surgeon who's got the aesthetic and has the understanding of what things, really, or how things really look best. and work out how much buccal fat pad to remove. Just out of interest, in relation to the operation, it's done inside the mouth. There's a little cut on the inside. There's a couple of little catgut stitches placed on the inside. Most people who have buccal fat pad removal, if it's done as an isolated procedure, say if it's done on a, I operate all day Tuesdays, all day Wednesdays. Say if you do it on a Wednesday, you can be back at work on Monday. You probably could be back at work on even the Saturday, let's say. It's not a particularly traumatic operation, very rarely bruises. There's very rarely any external signs of anything being done. Juliana asks, after massive weight loss, I'm needing full arm lift, tummy tuck, breast lift, etc., thigh lift, wanting a facelift. Do you recommend one massive surgery or breaking it up into stages? Juliana, for people who have massive weight loss, definitely you need multiple surgeries because there's a lot of loose skin. Now look, you need to see my esteemed associate, Dr. Amira Sankey, who does a huge amount of this sort of surgery. She's a fantastic surgeon and does a wonderful job at this sort of surgery, because what you usually do, or what Amira usually does, is several areas at once. So it's not like you can just have a tummy tuck or just have breast lift or whatever. Basically, often say a tummy tuck is combined with a breast lift, but then there's, you might need brachioplasty or doing the arms as well. There's many different combinations, and what we're thinking is what's the most surgery that can be done safely in any given setting, because safety clearly is the most important aspect of all of this surgery. And that's one of the things which we find so strange is people gamble so far, and so much, with their lives by going overseas and getting things done by, people who aren't even surgeons here in Australia. It's just like, it's nuts. So we don't understand it as surgeons. You wouldn't get in an airplane and, passenger in seat 3B, who's an architect, says, okay, righto, I'm going to fly. And everyone says, oh yeah, no worries, good, onto it. It's extraordinary. We don't understand it. Plastic surgery is a specialty. You get trained in it. Go see people who do plastic surgery. What's so hard? Generally, you often find the prices are similar. It's like it's crazy. And by the time you get over to Thailand or wherever you go and you come back and you get your complication fixed up, you've spent more than you would have by just getting it done, properly in the first place. Just, get it done. Anyway, enough of that from me. Beanie Bean says, I'd love to get rid of my bingo wings. What's the procedure? Is it painful? Beanie, I'm not exactly sure what you mean by bingo wings. I'm only assuming that you mean that it's this area here, the sort of like, the area of the arm, which some people call it bat wings. There is a procedure for removal of that. Once again, my esteemed colleague, Dr. Amira Sankey, does that procedure and does many of these procedures. I concentrate mainly on facial surgery, eyelid surgery, brow surgery, hairline surgery, and lots of people who basically have massive weight loss do need facelifting surgery because it's a deflation. And if you think about it, if you've got a balloon that's been blown up for a long time and that balloon is deflated of air, it gets all loose and it looks sort of like wrinkly. It doesn't look young and fresh, right? And so facelifting surgery definitely helps major weight loss patients. Beanie Bean, yes, arms, fat at the back. There is a procedure called brachioplasty. Brachio is Latin for arm, or brachium is Latin for arm, and I'm one of the few remaining, eras of doctors who learnt Latin. I did Latin for 4 years at school, and just out of interest, I'm a South Australian, and in 1976 or 7, I won the plain Latin speaking competition run by the classics department at the University of Adelaide, and that was, you had to have a piece of Latin text, and converse in Latin. So my era of surgeons were all trained in Latin because that's what you did at school. Whereas these days, not so much. My kids did 1 year basically. And look, call me old-fashioned, but Latin is such a great language and allows you to understand so many things in the English language. In relation to the question, brachioplasty, very frequently done. Frequently done for people who don't even have massive weight loss. It's one of the unfortunate ironies of life is that women do tend to get sag of the arms, men don't. It's got nothing to do with weight necessarily, although it can do if you have massive weight loss, but even people of normal weight, women of normal weight get sagging of this arm skin, whereas men don't. It relates essentially to the connections between the deep tissues and the skin. In women, those connections basically are vertical like this. In men, they're crisscrossed. And with the crisscross, the connection is tighter. And it's just a fact of life, and it's unfair, but that's why women get cellulite and men don't. And it's also why women get these bat wings in that area. One other question that we have, Juliana has asked, talk about hairline surgery. Juliana, thanks for all your questions. And look, if anyone else has any questions, I'm here for a few more minutes just to discuss various bits and pieces. Hairline lowering surgery is nothing short of extraordinary. I hadn't heard of it when I was going through surgery and doing my plastic surgery training. I don't think any of my bosses or people who trained me would have ever heard of it. And then I came across it in the early 2000s, early to mid 2000s, and I saw some people who'd had this hairline lowering surgery who had been coming back from a doctor called Dr. Shouldnt in the US, and it was nothing short of miraculous. Basically, what it does is long foreheads, it lowers the hair so that there's a much less long forehead. And the main people who do well with this surgery are basically young women. Now, men can do hairline lowering surgery, but I think because we answered this last time, because men generally have a receding hairline, it's not the greatest surgery for them. Hair transplantation is generally a better option for men, but because most women don't have a receding hairline, their hairline's fairly fixed from about the age of 18 or so, it's great surgery. And the long and the short of it is that technically an undulating incision is made, this area here is lifted up, things are done underneath the scalp to make it more stretchy, the whole thing is moved forward and put down again, a little bit lower, right, as broad as you like, and then the excess skin from this area is removed. And it makes just such a huge difference. It's just a wonderful, wonderful operation. One of the great things about it is it's quick, relatively quick. It takes about 2.5 hours. It's simple, quick recovery. We've had people back at work within 3 days. Now, I'm not recommending that. We always say to our people, take a week and a half. We have people back within 3 days. And then the other thing that we say is you need to be prepared to wear your hair basically in a fringe to cover the incision for a year. So you need to be prepared to do that. We've never had anyone who can't wear their hair back after that surgery within 3 months. The incision, to all intents and purposes, becomes that word I don't like using again, invisible. It gets really, really hard for anyone to see. It's extremely difficult for anyone to see. Look, I've been talking now for nearly an hour. I thank you very much for your questions and comments. I really enjoy doing these facelift live sessions. Facebook live sessions. It's a good exchange of information. You can get to see me. I get to understand what sort of questions people are asking. We do like keeping our ear to the ground. It's not some sort of lofty sort of situation where you come in and I say, you must do this, you must do that. We're very interactive and very much seeking out what we can do to get the biggest bang for your buck, the most impressive result with the least possible surgery. Now, that doesn't mean, doing mini lifts when a proper facelift is necessary, or doing mini eyelid surgery or things like that. What I'm talking about is really building the house on a solid foundation of brick, rather than the metaphor of building the house on drifting sand. You want good surgery, but you want stuff that lasts, not like thread lifts that you can get 11 weeks. You want facelifting, let's say, that lasts 20, 30, 40, 50 years, whatever, or the effect of it, the 10 years that you turn the clock back lasts a long time. So this is the last Facebook Live session for this year, 2016. Thank you for your questions. Save up as many as you like for next year. We are hoping to start again early in the new year. It's been a pleasure to be here, and have a great Christmas and New Year, everyone. Let's hope that 2017 is an excellent year. It's certainly going to be interesting with the Donald Trump effect. I guess we're waiting with bated breath to see what happens. Maybe he'll do some legislation in the US that everyone needs cosmetic surgery, I mean, like, the guy is a loose cannon, I guess, in a way, but good luck to him. He's got a very serious job, very serious role, and let's hope that he can build up to be fit for and great for that office. The people need it. We all need it as a world, as a country, and as countries. All the best, and until next year.